Today we're going to talk about the second phase of spinal decay and degeneration, also known as spinal arthritis or arthritis in the spine. It's all types of terms to determine or to explain spinal decay. Yesterday we talked about phase one. So phase one, if you recall, was loss of curve in either the neck, as we show here, or the lumbar curve on the X-ray that we showed. Today we're going to talk about stage two. So we have the loss of curve, but time has gone by. So the force of pressure from gravity on a straight, see here on a normal, when gravity pushes down, it acts like a spring. But now when we lose the curve, gravity's still pushing because it doesn't stop. So it starts to put abnormal pressures on the discs and the nerves here. So over time, so the loss of curve plus time plus the force of gravity equals degeneration. So we go into phase two, where we start to see the thinning on the X-ray, the space between the bones gets smaller, okay, and that's because of compression from gravity. It's sort of like an accordion being compressed together, okay. We also start to see these small points beginning to form on the edges of the bone, where we saw scalloping in phase one begin. Now we really start to see scalloping in phase two, and that's again from compression of the bone. You start to see these points, these osteophytes or bone spurs they're called. They're also known as arthritis. That's osteoarthritis, bone arthritis. You can also have tears or wear and tear of the disc itself. So we start to see thinning of the disc space. In this case, the nucleus of the disc itself has ruptured in this example here. This doesn't always happen in phase two, but we start to see this is a bulge or a herniated disc where the material is coming out from the disc. If this bulge hits a nerve in the back, it's going to cause a lot of symptoms like radiating pain down the arm or leg, or very common numbness and tingling down the arm or leg. Here we're going to get numerous episodes of neck pain or back pain if it's in the back. They're going to get disabling headaches, arm pain, numbness and tingling. They may still have normal head, neck, or back motion, but typically they don't. Typically they're going to have losses of range of motion. The instability of the individual spinal joints can result in excessive or decreased movement in stage two. So you've lost the curve in phase one. In phase two, we start to see actually change to the bone matrix itself. So those are the hallmark symptoms and signs of decay in a phase two spine. I'm Dr. Lininger, and tomorrow we're going to talk about, or the next video, we're going to talk about phase three, which is the ultimate stage that I see in my office of spinal decay. You can go past stage three, but they're typically not walking through my door. Okay, I'll see you tomorrow on the next video, and I'm Dr. Lininger. Have a nice day.